Good evening, family, ladies and gentlemen. I hope visitors have been invited. Welcome to Applied Neolife. We haven't had Applied Neolife in the month of May. This is the first one. And we've decided to talk about autoimmune disorders. That was requested by a dear member of the Neolife family. My name is Esa Zanambasi. I am a medical doctor by training. I am very passionate about what we do in Neolife, basically because it makes a lot of sense. So as regards autoimmune disorders, I would like you to help your friends and family to connect the dots. And that's what Neolife affords us, the opportunity to connect a lot of things in our lives and see that, in fact, we have choices as regards what happens to our health. So, what are autoimmune disorders? That's the question we need to answer. When the immune system reacts to its own tissues and cells as if they are invaders, leading to chronic inflammation. That's the description of an autoimmune disorder, and you'll soon discover that there are many autoimmune disorders. For example, diabetes, rheumatoid arthritis, lupus, multiple sclerosis, various problems with the thyroid, various problems with the bowel. Okay, and celiac disease is a specific chronic inflammatory disorder that has been associated with wheat allergy or sensitivity. And it seems is quite common and very, very damaging to one's health. And then, of course, we might have them manifesting in the liver, the kidneys, and the skin. You've seen people with patches of pigment loss. We call it vitiligo. And yeah, so there are hundreds of autoimmune disorders. And in one patient, there can be more than one autoimmune condition. And now what triggers them? Toxins. And yeah, you might think that we become really fanatical about talking about toxins, but yes, you need to be aware of them all the time. Infections, various causes of infections like bacteria, viruses, and fungi. Infestations, allergens, I've mentioned gluten from wheat, and wheat gluten is found to be most notorious. Then other things like dairy, eggs, nuts. There's a wide spectrum of sensitivity in different individuals. And then if somebody is chronically malnourished, their body is incapable of putting up a good immune fight. That can lead to autoimmune conditions manifesting. And then, of course, the big one is stress. And you know, all of us can say, I'm not stressed, but stress can appear in all sorts of ways. There are many ways that stress manifests. Now, an example is rheumatoid arthritis that affects the joints, and it can affect several joints, and it is accompanied by fatigue and sickness. It has been associated with allergy or hypersensitivity to foods, and it is also thought to be as a result of infections. Now, common triggers for rheumatoid arthritis are exactly as I mentioned, but I want you to note in particular hormone imbalances and high blood sugar, and obviously food allergies. And then we are always talking about toxins. It's actually a major issue. Often associated with rheumatoid arthritis is non-specific muscle aches and pains. So if you see people always complaining about sore muscles, sore joints, it could also be due to vitamin D deficiency. And so now the modern thinking, the current thinking is that autoimmune diseases manifest more commonly as a result of the very rampant vitamin D deficiency that most people suffer from. It's a common deficiency, in other words. Other associated symptoms include lower backache, fatigue, difficulty to sleep, headaches, and depression. And for those of us who live in areas of the world where winter happens, yes, it is very common for vitamin D to be deficient because obviously people don't go out in the sun. And on top of that, our darker skins that we have as dark-skinned people tends to block the formation of vitamin D. So remember that one. It's a very common deficiency. So how can we suspect an autoimmune disease? You know, just listen out. If you hear people saying aches and pains and joints that are inflamed and rashes, fatigue, weight gain, and fluid retention, and chronic or recurrent digestive disorders such as bloatedness, cramps, diarrhea, okay? Mood disorders, organ dysfunction. So as you can see, it is not easy to make a diagnosis. One has to have a high index of suspicion that this is what might be going on. And one has to also ask, does food really matter? Yes, it does. Too much meat in the diet is associated with increases of autoimmune responses by the body, and those can manifest in different ways. They might manifest as heart disease, it might manifest as infertility, all sorts of ways. So now, I like to remind ourselves of a man that was called the father of modern medicine. But he lived many, many, many years ago, as you can see, in ancient Greece, a long time ago. And he said a few pivotal things, but the last statement is attributed to him. All disease begins in the gut. That is crucial to realize. So, you know, the gut speaks to us. We might eat something, and after some days or hours or even weeks, the body manifests some discomfort or an outright disease. So listen to your body. And I have personal experience, I really do. I'll tell you if there's time. So that's the picture that I like to show of the gut. Just to realize that this is where the food comes in, on this side of the body. One layer of cells separate the outside world from the bloodstream. So that layer of cells can easily be disrupted so that the tight junctions are broken and the gut, which was formerly healthy, becomes very, very leaky indeed. And so we have to be very careful of what we do to our gut. But how do you do that? Well, just become more knowledgeable, more aware. The importance of balance in the gut, I want to spend a few minutes describing why it is so important. The gut is the home of trillions of bacteria and other organisms. Good gut bacteria are important. They help us with digestion. They produce certain vitamins. They even educate the immune system by making fatty acids that help with the immune response. And the gut is so important because about 75% of the entire immune system actually lives in the gut, okay? So as it breaks down the food and specifically certain fibers to create those fatty acids such as butyrate, those are what protect us from autoimmune diseases. So once we are aware of how important the gut is, we'll have a bit more respect for it, and we probably would choose what we eat more carefully. The immune system, which resides largely in the gut, needs to be in balance and to stay alert at all times. And we've already said an autoimmune disorder is when the immune system turns on against the cells in the body. That is how it happens. So the immune system protects us against foreign invaders as well. And it is responsible to recognize the body's own tissue and organs to protect them from being attacked. So attack happens and disease as a result happens. I've talked about things that can cause challenges. So avoiding glutens, avoiding refined sugars, all those things. And I just put it on another slide, examples of inflammatory foods. Alcohol, carbonated cool drinks, the ones that people live on literally. Instead of drinking good, clear water, they love the carbonated cool drinks. We've talked about red and processed meats. Some people, dairy is very inflammatory. And hydrogenated fats, such as margarine. If you can avoid that, you will most likely save yourself from developing manifestations that we call autoimmune disorders, okay? And obviously refined foods. So wheat, here's a little slide that says 8 reasons to avoid wheat. Okay, wheat is a very commonly eaten food, but some people, especially as the aging process progresses, I discovered it for myself that as I grew older, I became more sensitive to wheat. But it was just because I became aware. And now that awareness caused me to eliminate it from my diet. It's not easy, but I did. I tried. And it's now about 7 years that I'm very, very careful to avoid it. But when I do eat it, I suffer. So recently, we've just come back from the World Team Conference and vacation. I was tempted to taste some, and I'm just recovering now from severe joint pains. And the longer you avoid something that triggers a manifestation of autoimmunity, and then you go back to it, the more excruciating the pain and the manifestation happens to be. But if you are unaware of it and you just carry on and carry on, the damage continues more slowly. So I just say to myself that my body is now really intelligent because I discovered that. And that's how, for those who might want to know, I managed to shed a lot of weight. I used to carry around a lot of weight. So autoimmune disorders occur 10 times more commonly in people with celiac disease, which is the disease that happens in the gut as a result of wheat allergy or sensitivity. And it varies in degree. It's on a very, very wide spectrum. Some people have very mild, other people have severe. Most people are somewhere in between, and it doesn't bother them, as it were. But here are the 8 reasons. Modern wheat strains are often crossbred, with toxic chemicals. Wheat is doused in pesticides from seed all the way to storage. Then high heat drying methods that are used destroy whatever nutritional value is left. So celiac disease and gluten sensitivity, many are unaware of the gluten problem. That's what I've just said. Wheat is addictive. It has that protein called gluten, which is formed into glutenin, and it's what makes the wheat, when you cook it, sticky and pliable, and you can knead it into dough and make the bread. And then you have gliadin, which has opiate effect. So, people find it very pleasurable. It hits those pleasure spots in the brain. The dopamine is released when one eats a good amount of wheat products. And that's why people enjoy bread. And that's why I sometimes get tempted, but I've learned my lesson from this last week. Also, it can be neurotoxic. In other words, it has properties to cause toxicity to nerves. That's what we call neurotoxicity. And it causes nerves in the periphery, in the feet and the hands. And I must say, before I realized that, hey, this is possibly what's happening to me, I used to get tingling in my fingers and my feet, especially at night. And I thought, what is going on? So it was a process of discovery for myself. I'm not speaking for anybody else, I'm speaking for myself. And then wheat spikes blood sugar. It is actually one of those that triggers blood sugar quite significantly, and therefore insulin. And it results in disease-promoting chronic inflammation and leakiness of the gut that we have discussed, allowing a lot of particles to enter the bloodstream and create disease conditions. Now, I hope I haven't discouraged you severely from eating wheat, but here is a slide I discovered, and at the bottom it says gluten sensitivity is a systemic beast in our healthcare system because it can manifest in all those ways: foggy brain, anemia, constipation, psoriasis, oral ulcers, rheumatoid arthritis, headaches, and most of these things might not show up in younger people, but as people grow, there's a phenomenon called loss of tolerance when something is eaten by mouth, and that's why it is increased. All these conditions tend to be increased in older people. And it has also been associated with mental health conditions such as schizophrenia and loss of balance and other undiagnosed or undiagnosable neurological or nerve conditions. So without sounding like I'm telling you, please stop eating bread and biscuits and all that, you choose for yourself. And that's the purpose of these applied near-life and sessions. So question is, why near-life? Near-life was approached many, many years ago to say, what can we do about the whole situation of autoimmune diseases? So let's get back to basics and introduce to you our esteemed scientific advisory board. This is a group of scientists that research and develop everything that we have. It was established in the mid-70s. You have to remember, for the guests, that Near-Life has been in existence since 1958. And the founder member, Dr. Arthur First, was very, very passionate about good nutrition, whole food nutrition, And he arrived with his immense knowledge, vast knowledge on toxicology, pharmacology, and cancer. He was a cancer researcher. In fact, he pioneered oral chemotherapy. So now these are the current members of the Scientific Advisory Board, and we are so proud that they've taught us a lot of things. But the most important thing that we in this family know is the importance of cellular nutrition. We are all made out of trillions of cells, and by feeding those cells at that level, at the cell level, and really the research that has gone into all the supplements that we have is such that they are based in nature and backed by science, in that they are whole food nutrition supplements. The flagship is called TreeNN, which I'm going to describe, but you need to understand the wellness triangle. We all have to do a lot of physical activity, and we have to have the energy to do the physical activity. And in order to be able to do that activity, we have to have good weight management. I've mentioned that I had challenges with weight management before I discovered that I was actually sensitive to something that was keeping me bloated, and yeah. So we need to do that, and that comes with whole grains. Now, I need to pause and say whole grains are very, very difficult to come across. I've explained why modern wheat is even more difficult, and perhaps not a very good idea to keep eating. And then we have to eat lots of fruits and vegetables. We have to make sure that we get our protein and fats and sugars. That's the wellness pyramid. Unfortunately, it has been turned over because people hardly do enough exercise or manage their weight, and instead there's too much fats and sugars and the wrong fats in our diets, and we don't get enough of the other nutrients that we need. So the result of that is that our energy levels dwindle, and we become sick and tired, and we get maintained on a lot of medication, which actually might lead to leaky gut, increase the permeability of the gut, and instead of helping, increase the amount of inflammation-causing particles into our bloodstream. Now, what we advocate is that you need to understand at a cellular level, whole grain oils that were processed out of grain are required because they have the same biochemistry, the same chemistry as the cell membranes and the mitochondrial membranes within the cell. So because we don't get them, our cells are no longer healthy, they become very unhealthy. Neolife was the first company to come up with a solution, and the solution is known as TreeNN. It's what we would recommend you start with, and on top of that, you can build a lot of other things. So when people ask, do we really have to supplement our normal diet? Well, I think we do. And as I've said, I've spoken from experience, and I discovered that I needed to do something different. So by becoming intentional with what you are eating and trying to eat as well as possible, largely plants, you would bring down inflammation, okay? Eat food, not too much, mostly plants, and if possible, not over-processed. So that's why I'm showing you all these pictures, because those are low or anti-inflammatory foods, okay? So inflammation is what we need to be aware of. And I just want to say the body's response to infection and is with inflammation. That is nature's way of limiting damage from bacteria and allergens. However, when we doctors give anti-inflammatory medications, those medications remove the inflammatory barrier around the source, be it the bacteria or the allergen or whatever it is. So the body's natural response called inflammation is removed. Okay. So once that becomes now a chronic condition, then there's a problem, because inflammation is nature's way of holding the reaction in check. And once it is over and the body's immune system has cleaned it up and sorted it out, then it should subside. It is when it doesn't subside that we can then have conditions called autoimmune disorders. What we offer and what we are offered by Neolife are food called fish, grain, and legume oils, extracts, obviously. And those perform a twofold function of both acting as natural anti-inflammatory substances, okay? And they also enhance the immune function and help the immune system. So rather than destroying the immune system, okay, they actually enhance it so that that closes off whatever is causing the infection, or such as the allergen or the bacterium. So we also have antioxidants that protect the fats and boost immunity. And I just want to contrast what Neolife has offered us with what drugs do. The anti-inflammatory drugs tend to suppress immune function, and you don't want that to happen. So we have a product called TreeNM. It is the foundation. I've pointed that out. I just wanted you to have another look at it. And it is within the core nutrition, as you can see. But the core nutrition has more than just TreeNM. It has those things. So this is the fish oil that I've described. These are the antioxidants that we've described to protect these oils. And then you have the vitamins and minerals that work with the cell. And other things such as vitamins and antioxidants and minerals are all very, very important. Our minerals help, and it is known that a good supply of calcium helps to coat the inside of the gut properly, and it can be protective against colon cancer. Ours is double amino acid chelated, thanks to the pioneer, Dr. Arthur First, the pioneer of the Scientific Advisory Board. Its absorption is therefore at least 6 times a product that is non-chelated, and it is therefore very well absorbed. It is not irritating to the stomach and intestines. Instead, it is protective, and it rapidly disintegrates and is dispersed. Now, by protecting the gut, and this is just some news that you can use, using calcium and other minerals, calcium and magnesium in our case, you can help the body to reduce the incidence of autoimmune diseases or conditions and manifestations, because the gut then becomes less leaky. And that's what I wanted to point out. We are busy connecting dots here. We have other products like for blood sugar control. We've said a high blood sugar can bring about autoimmune manifestations. And then I would like us to say the first thing to do is to protect our little ones. We have supplements for them too. Although those little ones that can swallow adult supplements, there's nothing to stop them at all. Our products, they're not artificial. There's no artificial anything, and they don't have all those things that we have said can trigger challenges such as preservatives, gluten, um, hydrogenated fats, saturated fats. And this is describing the protein powders or the Neolife shake and the sports shake. They are very, very well formulated not to cause autoimmune conditions. Right, and now talking about toxins, you know, unless you remove the possible offending toxin, you will find that you are fighting a losing battle, because the older you grow, the more exposure and accumulation, the worse conditions become. So choose the best for your family and for your home. We also have personal and skin care. Choose the best. And we do this because we trust our scientists who have spent a lot of time researching and developing what is the best for us. So why Neolife? And this is the answer to autoimmune conditions. Now, why Neolife specifically is that it gives us the opportunity to make choices for ourselves and our loved ones, and to have a total opportunity and to be able to afford it, because in there is an opportunity, a business opportunity, an opportunity for you to earn some money. So my advice is make Neolife your lifestyle. And together we make the world healthier and free of financial stress. So thank you for listening. I'm just now going to stop the share and suggest that those of you who want to discuss are more than welcome to put up your hand and make your comments and contributions. Thank you.